Welcome to the Lincolnshire COVID-19 vaccination webinar. I'm Maria Pryor, Chair of HW Links, which is the parent charity for the Healthwatch Lincolnshire contract, and it is our honour to be asked to host today's event on behalf of NHS Lincolnshire and Public Health and Social Care Services. We have with us today on the panel the team who are in charge of vaccinating the Lincolnshire population against COVID-19. And we've been delighted with the response from the public to this event and have had over 250, and I believe it's nearer 300 now, registered to attend. And we've had over 160 questions submitted. Now, these questions have all been reviewed by the HW Links team and, where possible, have been grouped into themes so that we can get as many answers as possible during the time we have available today. In a minute, I'll hand over to our panel, who will introduce themselves and briefly outline their role in the vaccination programme. We'll then swiftly move on to hearing answers around the many questions sent in, and this will fill the rest of the time of the webinar. You will have received a document by email today with a copy of the thematic questions we will be asking our panel, and we will endeavour to get through as many as possible in the time available. If there are any questions we don't get to today, don't worry, as our NHS and Public Health and Social Care colleagues will be providing written responses to all of the questions submitted as soon as they can, and not just those listed that we're asking today. These will be available for all to see, again, as soon as possible, and no identifiable information will be included in any published information. We're also offering you the opportunity to submit additional questions during this webinar via the Q&A function at the bottom of your screen. However, we will only be putting these questions to the panel if there is sufficient time and if a question is asked that has not been raised before. So without further delay, I would now like to hand you over to our panel to introduce themselves. So firstly, to Martin Fahy. Over to you, Martin.
Thank you for that, Maria, and good afternoon, everybody. It's not quite evening yet, but my name is Martin Fahy, and I am the Director of Nursing in the Lincolnshire CCG. I have the exec lead and what's called the SRO, or Senior Responsible Officer, for the COVID vaccine rollout across Lincolnshire. And I really want to say right at the start, I am surrounded by a number of really esteemed colleagues on the call today, and without their help and support and all the staff that stand behind them, you'll hear lots today in the coming we've got about an hour and a half, haven't we? But of our progress to date and all the progress we've made rolling out the vaccine. But it really has been a team effort, and not just within the family of the NHS, but across our local authorities, volunteers, and many other partners that are too many to name in many ways. But I wanted to make it really clear from the start that this is a real team Lincolnshire effort. And although I might be the exec lead, I'm certainly not taking all the credit. But nonetheless, I will take all the difficult questions as to why we aren't where we are, or what I will do my best to explain as we're doing our best to deliver the programme. I'm mindful I won't take too much time talking, Maria, because I think people want to get into the questions, don't they?
Yes, they do.
And I'm mindful of other colleagues when I've sat in these briefings myself, they spend too much time talking and don't give people enough of a chance to ask the questions. So I'll be really tight in that respect. I do want to remind people of the scale of the challenge, and I think a lot of people will be aware of that. But the rollout of this vaccine is, without doubt, probably singularly the biggest thing the NHS has ever done, if the truth to be known, particularly the scale and the speed as to how we had or have had to roll out this vaccine. In the space of about 6 weeks, some people have likened it to comparison of rolling out a national chain of supermarkets in the same timeline. So it's just to give people the scale of the challenge. We've had to bring together quite a number of our partners to do that. And I just want to give a sense of where we are, because I, for one, have to say we knew about this vaccine just before Christmas, but we didn't get the actual confirmed agreement, if you like, that we could use the first vaccine that came available to us. And that was the Pfizer vaccine. So we got notice of that just before Christmas. And we were right at the very front foot, in some extent, in Lincolnshire. We were first 2 NHS hospital hub sites opened up and in the position to deliver the Pfizer vaccine. Followed very quickly on the heels, within a matter of days, we had our primary care network sites set up, which are our GP offers. And I know we've got other colleagues who'll explain a little bit more about those local vaccination centres in a minute, so I won't go into all the detail. But what I really want to be clear about that is we were very first with the hospital hubs, 2 of them. We were very first with the primary care offer, the local vaccination centre. I'm very pleased to say as of this Monday, we were the first large vaccination centre to go live in the East Midlands. So for Lincolnshire, we've had a lot of firsts. So we've worked really hard to get those vaccination offers up and running. My colleagues give a little bit more detail about where they are and where the various vaccination centres are. And Rebecca will probably pick up that detail in a minute. So I won't go into too much about that, but there will be lots of opportunities to ask any questions about that, and we'll explain where they are, how they can be accessed, and what the current priority groups are. And the other bit I really wanted to emphasize today a little bit is our first part of our challenge is to do, we have 10 categories, but at the moment we're trying to work with the first 4. And the first 4 are, one is residents in care homes for older adults, their carers. The second one is everybody over the age of 80 and frontline health and social care staff. The third one is everybody over the age of 75. And the fourth one's kind of 2 bits, everybody over the age of 70 and what's defined as the clinically extremely vulnerable. So that's a mix of people with long-term or complex health problems, or sometimes described as underlying health conditions. And to put a bit of context in Lincolnshire, we're the second biggest county in England. We're without doubt the biggest county in the East Midlands. We occupy footprint of about 40% of the landmass in the East Midlands. We have one of the highest populations of older adults across the East Midlands. The reason I put that in context is we have a significant number of people to vaccinate within those first 4 cohorts. So we will need to go faster than many of the other counties to some extent to get over that initial cohort. And at the moment, we're working very clearly to the national ambition, which is to deliver those 4 cohorts by the middle of February. So that's where our ambition is at the moment. And I'm really pleased to say right at the start that we're already quite far along with that. As of today, we've vaccinated 75% of all of our care homes in Lincolnshire. And as of today, we've done just a little over 56% of all of our over 80s. So I really want to be clear that we're well and truly on that journey and making really considerable progress at the moment. So at that point, I'll hand over to the next person. I think it's Rebecca.
I think that's me next, David Stacey. Hi, good evening everyone, or afternoon everyone. My name is David Stacey. Thank you, Martin, for that intro. I work for the public health team at Lincolnshire County Council. So my role within the vaccination programme in Lincolnshire is twofold really. I provide the sort of public health advice and support for the programme, and the links into our public health teams in a wider sense. But equally, from the county council perspective, also I act as the lead officer for the county council in respect of social care. And Martin's just touched on the fact that social care staff, both in terms of older people's care homes and in terms of the wider social care workforce, are both within those top 4 cohorts, so are clearly very high priority for us as part of the programme. And I think what's really clear from my work with all of the partners that are represented here on the panel today is that this has been a real, as Martin said, a real team effort. And from a social care perspective, from a local authority perspective, it does genuinely feel like social care has been a real equal partner in this, along with health colleagues. Right from the outset, Martin mentioned the hospital hub at Lincoln being stood up as one of the first hubs in the country. And on day 1, social care staff were being vaccinated at that hub as well. So right from the outset, really been a core part of this programme, and that's to the credit of everyone on the panel who's been involved in that. Just from a public health perspective then, I won't go into too much of the detail in terms of the numbers and the figures and the rates, because we see that on the news every day and it fluctuates. But I think more just as a general kind of summary of where we're at the moment. So we're clearly in the 3rd lockdown now, and there's a pattern that emerges from those lockdowns. And what we're seeing now is that in terms of rates in Lincolnshire, we are starting to plateau, and if anything, starting to slightly come down a little bit in our rates following the easing of the restrictions over Christmas. We peaked our rate peaked at around about during the week of the 4th of January following Christmas, which follows the pattern of roughly 2 weeks after you ease lockdowns, you tend to see an increase in rates. But equally, we know that there's also a sequencing in terms of the knock-on effect that has in terms of people not just getting ill, but then becoming more severely ill and needing hospital treatment. And then unfortunately, some of those people will after that period of having been seriously ill, pass away. And so we're still not out of the woods, is the point I'm making. So the rate is starting to look like it's coming down, but that's by no means means that the hospital is still under intense pressure in terms of people requiring hospital care. So generally speaking, that's where we're at in terms of the pandemic and the population at large. We've done an awful lot of work in Lincolnshire as well with our care homes, and I think it's fair to say throughout the pandemic, although we have very sadly had deaths and outbreaks in care homes, understandably, we haven't been as effective as other areas, and that's largely in credit to the health protection team that we have working in the local authority. Have done a huge amount of very proactive work with our care sector to try and support them throughout the pandemic. Just in touching on testing then, so we have a number of testing sites in Lincolnshire currently where people who have symptoms can get tested, good geographic coverage across the county with regards to those. And we have also recently started community mass testing. So that's testing of populations, whether they have symptoms or not. And that's happening at the moment in Lincoln and Boston. And that testing is finding positive cases, about 2% positive cases overall. So those are people that don't have symptoms, but do test positive. And that's really important from a public health perspective, because that means that, particularly with the new variant, which is more transmissible, we're finding people who don't know they've got the virus yet, who may therefore potentially be passing that on to other people without knowing it. And so we're able to intervene earlier to make sure that doesn't happen. So that testing is really, really important, and that's currently rolling out in Lincolnshire. And then just my last point really, by way of introduction, would be about vaccinations in general. So from a public health perspective, we know that from the evidence globally, after clean water and sanitation, vaccinations are the most effective public health intervention that we have globally in terms of saving lives and promoting health. But we also know that targeting and prioritising of those vaccinations is really important. And with COVID-19, age and clinical vulnerability are the biggest risk factors of mortality, and hence why those are the primary focuses for the programme from the outset in terms of priority. And just lastly, the message for me really would be, when you get invited, or when your friends, family, colleagues are invited for your vaccination, I'd urge you to get vaccinated. It's our way out of this pandemic, back to some form of normal life. But once you have been vaccinated, it is still really important that you follow all the COVID guidance in terms of hands, face and space, even if you've got that vaccination. And at that point, I'll pass over to Rebecca, I think, who's next to introduce herself. Thank you.
Good afternoon. I'm Rebecca Nino, Deputy Chief Nurse for the CCG and the Programme Officer for this vaccination programme. I have been very fortunate that I have been working on this programme since the autumn, so it's absolutely fantastic to see some of that work now become a reality. The themes and the pillars, if you like, of delivery, I will talk through those briefly in a moment, and then I'm going to hand over to my colleagues to talk a little bit more about the individual pillars that come together to make up the whole programme. What I would say first is that the strategic aim of this programme, and for us in Lincolnshire, we're focused on vaccinating as fast as we can, but in a safe way, and that is absolutely crucial as we move forward. The NHS is experienced in vaccination programmes, but the difference with this programme is the scrutiny and also the pace of delivery that we need to achieve. And the way we've designed the programme is absolutely to address those aims. So as Martin's already said, there are a number of pillars within the programme that make up the totality, and where you access a vaccination will depend upon, in essence, the pillar that you access. We have 2 hospital hubs currently running in Lincolnshire, one at Lincoln County Hospital and one at Pilgrim Hospital in Boston. Those hubs are vaccinating our health and social care workforce. They are our priority 2 cohort, and they are working their way steadily through that group. And I'm going to hand over to Martin Rayson shortly, who will talk a little bit more about the hospital hubs. We then have 13 local vaccination sites. They are sites within communities across Lincolnshire where GP practices have come together under the what we call PCN, primary care networks, to offer a designated site within local communities. And again, Dr. Baker is going to talk a little bit more about those in a moment. Those sites are calling patients directly. So some of you on this call may have already had a vaccination through those sites, and all 13 sites are now up and running. We had, as many of you will be aware, our first vaccination centre go live this week at Boston, and to access that site is via the national booking system, where patients are receiving letters and encouraging you to ring or go online to book. They are not, they are complementary of each other. So if you do not want to go to a vaccination site, that's absolutely fine to wait for your local vaccination site to call you, and you will be called. That is, we're absolutely clear, we've got mechanisms in place to call patients. We'll have a further vaccination site coming online over the coming weeks in the north of Lincolnshire. And then we also have our roving service, which is the service that we will bring to you. So you can see that operating at the moment within our care homes. And we are on course to complete our care home vaccination programme by Sunday, the 24th January, so this Sunday. And then we will be turning our attention to be vaccinating those individuals who are housebound within the appropriate categories. The appropriate categories, as you've heard, are the cohorts, as we call them, that we're working to, the JCVI cohorts. We're focusing on cohorts 1 to 4, but we have an overarching plan that reaches down into cohort 11 and then further down to the rest of the population. At that point, I'm going to stop and I'm going to hand over to Martin Rayson to offer you some more detail regarding the hospital hubs. Martin.
Thank you very much, Rebecca. My name is Martin Rayson. I'm the Director of People and Organisational Development at United Lincolnshire Hospitals Trust, and I'm called the Senior Responsible Officer for the hospital hubs. So we opened one of the first hospital hubs at Lincoln County Hospital. First vaccinated on the 8th of December it was, and initially we did do a few over 80s in our outpatients department before we decided other places were probably better places for over 80s to be vaccinated. I think the first person, Leanne, is one of the panel members. She delivered the first vaccine. I think it's a nice story, to an 84-year-old lady who was a healthcare professional, retired herself, and had participated in, I think it was the polio vaccination program many years ago. So that was a very nice story. We have been delivering the Pfizer vaccine at Lincoln County Hospital since then. As I say, primarily to that priority group, which is frontline health and care staff. And later on, we've also been one of the first hospital hubs to start using the AZ vaccine, the Oxford vaccine, down at Pilgrim. We have now vaccinated over 11,000 health and care staff, and that's really important, because those are staff who are delivering services to the people of Lincolnshire, who are obviously putting themselves at some risk in delivering those services. So it's been fantastic to be part of a programme to start to deliver the vaccine to those staff and give them a level of protection against COVID. The feedback from our staff has been fantastic. They've received a fabulous service in coming forward and been really pleased to be part of a programme, both in terms of delivering the vaccination and receiving the vaccination, which gives us a bit of light at the end of the tunnel. Still a long way to go, as David has said, still important to stick to the key principles that keep us all safe, but a programme delivered through the hospital hub that is really starting to make a difference to people. So I'd like to pass on to Sunil, who is going to talk about PCNs.
Thank you, Martin. Good evening, all. My name is Sunil Hindekar. I'm a GP and actually have not a true yellow belly, but I've been in Lincoln for 30 years. I'm really passionate about this programme. GP practices about 18 months ago came together in so-called primary care networks. So we were already forming groups across our county. And as Rebecca said, there are 13 such sites around our county coming together. And when this programme was first mentioned, and even before when the vaccinations came on board, each of us, but every primary care network has a clinical director. I'm one of one in Lincoln. All of us together were absolutely clear that we have a duty to our patients and to our county to do this vaccination. We all volunteered, and I'm really pleased to say 2 of our bigger PCNs, and Dr. Baker will tell you about the experience of one of them, went first. They were in the first wave around the country and started vaccinating well before Christmas. It was a really great effort. And I can recall in the planning phase when the clinical directors came together, the words of one of my colleagues, in spite of all the issues that you can imagine that this scale of program would cause, said, we're doing this for our patients, for families, for friends. We are absolutely clear as PCN clinical directors, we want to make our county safe. And we are working the long days, weekends, short notice, all that we can do to make our county safe. And as I say, I've been a GP for over 30 years, and I have to say, this has been one of the most humbling experiences that I've ever had in my career. And patients sit there before you and say, thank you, it's the first time I've been out since March of last year. And there's a tinge of hope in what they're saying. That's what this program's about. It really is about getting our county safe, and collectively, together, we can do this. And in terms of the cohorts that both Martin and others have said, the reason that happened is because of the clinical risk. So we make a clinical judgment of who is most at risk of this disease and start there with vaccination. And then we work our way through and assessing the risk as we're going. So in terms of calling patients, it's our job to call you, and we'll do that. And when you turn up, you'll be given a card. Please keep it safe, would said, by when you'll be called back. So we will call you back. So the scale of the program, it is the biggest ever. But actually, I'm really energized by this, as are my staff. I don't have any problems in getting people to work the extra hours. And I'm sure Dr. Baker will say that to you in a second. We are all absolutely clear why we're doing this. And the reason is keeping our county safe, get as many people vaccinated as possible, and try and get from under the grip of this illness, which has been quite devastating in some parts of our county. So if I hand over to Dr. Baker, who's been one of the first to go in his site.
Thanks, Sunil. Hope everyone can hear me okay. I'm Dave Baker. I'm a GP in Grantham. I've not quite been in Lincolnshire as long as Sunil, but I have been in Lincolnshire for 29 years. I'm actually the locality lead for the CCG for the southwest area, so that covers population of Grantham and Sleaford. So we cover 2 primary care networks, or PCNs, and we have a combined population of about 130,000. We established our PCN vaccination centre in Grantham, and that went live on the 15th of December. So that was, again, one of the first in the country as a Wave 1 site. And I have to say that, you know, the effort and the work that's gone into getting that together, not just by NHS employed staff, but actually by lots and lots of volunteers who've been fantastic to help us. You know, I really can't I can't extend my thanks enough to everyone that's got this system going for us. So next week we'll be vaccinating somewhere between 5,000 and 6,000 people, and we actually have a capacity to go up to 10,000 if we had sufficient vaccine. So it's quite a big operation that we have now at Grantham, and it's certainly the largest of the PCN sites in Lincolnshire. And we have a team of around 25 people on site on any day that we're vaccinating. So that's up to 8 vaccinators. We have administrative staff to enter all the details onto the systems that we have. We've got stewards, we've got volunteers, we've got helpers, got people in the car park. So it's quite an undertaking, quite an organisation to get these vaccination sites going. But as I say, we've had fantastic support to get this off the ground. The other thing that we coordinated from the vaccine centre is the roving model that's been mentioned. So we will have completed all of our care homes by early next week, and we're then now moving on to all the people that are housebound, and we've got practice staff and the team that are also working at the centre that are going to help to vaccinate all the housebound as well. And finally, we are aware of the difficulties some people do have in terms of travelling. So we are now putting up some pop-up sessions in other parts of our area, so around the Sleaford area and the south of Grantham as well. So we're aiming to get to absolutely everybody. We've got a really good system now for contacting patients. So we've got all of our practice staff that are ringing, sending invites via text, and we're chasing people up. So no one's going to be forgotten in this programme. We will absolutely get to everyone. So thank you.
I think we're going.
I think it's over to me now. Hello there, everybody. My name is Tracy Pilcher. I'm the Director of Nursing, AHPs and Operations, and I work for Lincolnshire Community Health Services. So I'm delighted to join the panel this afternoon, or this evening as it might now be, as it's got a little bit darker since we started. LCHS, as people know, is the provider of community health services across Lincolnshire, and we are also now providing what we describe as the vaccination centres. So we will have 2, I think Rebecca described, vaccination centres. These are the large centres. One that went live on Monday, which is the Princess Royal, just outside Boston, and then with second centre, we're just planning that going live in the next couple of weeks. And these are, again, as Rebecca describes, these are complementary. They're here to provide an additional option for the public in terms of how they might want their vaccine, but they are targeting exactly the same groups as the other vaccination hubs. We will, all of us are targeting our priorities. Priority 1, obviously, is the care home residents, the over 80s. We've got healthcare staff and social care workers. And we've also then got the over 75s, the over 70s, and those that are clinically vulnerable. So the letters come out directly to patients, and they are given the option of either booking via their GP. So as people have described, their GP practice will phone them to book them in, or they can access via our online booking system. Again, huge thank you to all of the people that have contributed to setting up these centres. They were a phenomenal piece of work of logistics, finding the sites, describing how they would be accessed by the public, and trying to find sites that would be easily accessible, but obviously had the ability to deliver large amounts of vaccinations. So Princess Royal at full capacity can deliver 1,560 vaccines a day, and with the Lincoln site, when that goes live, with the sites just north of Lincoln, again, just over 1,000 vaccines. So really stepping up our vaccination programme across Lincolnshire by using these vaccination centres. But again, it is volunteers working there. We have student nurses and a large range of different staff contributing and delivering the vaccine, and a real motivation. I think everybody has described this real motivation by people, by the people delivering the vaccines, to get it out as quickly as possible. We know that this is a real part of our ability to beat COVID, the pandemic, and I think everybody is absolutely motivated and committed to trying to get those vaccines out as quickly as possible so that we protect the people of Lincolnshire. I think we've all heard very early stories from patients talking about, you know, I can't wait to be able to hug my grandchild again. There are very small things that we might think that bring pleasure into people's lives, but their families and the connections that they have with families is absolutely pivotal to people. So that stems and makes us more committed and more passionate and motivated to enable us to deliver that to the people across Lincolnshire. So thank you very much. I think I am handing over. I'm just going to have to check now who is next. It's Linda.
Good afternoon or good evening, everybody. First of all, I must apologise for being late, and secondly, I'd like to apologise for the slight sort of background hubbub that you can hear, because I'm actually speaking to you live from the Princess Royal Sports Arena, which is our vaccination centre in Boston. So happy to have any questions, and I'm happy to give you an overview of what we've been up to over the last 3 days since we've opened. So bear with me.
Linda, if you could just say a little bit as to how it's gone in the last couple of days, that would be really helpful, and that's kind of what we want to hear. That'd be
Yeah, not at all. It's certainly been an exciting sort of slight roller coaster getting up and running. What's been absolutely wonderful is seeing how the public have responded to having been able to come to the Princess Royal and get their vaccination locally, which has been hugely thrilling. And I must say, everybody who's been along has been very grateful to receive their first vaccination and quite excited to receive it. But for me, as a professional, it's been truly inspiring to see how different organisations have just sort of dropped everything and worked together to make this happen, how the sort of local population and local businesses of Boston have pulled together and make this happen. And it's that sort of the permission to go ahead and be brave and do something that we've never done before, and that has that's truly been inspiring. So yeah, I'm thrilled that we're beginning to see more and more people come through our doors for their vaccinations. It's been marvellous.
Thank you, Linda. Really helpful. We're just going to move on to the next presenter, please.
Hello there, my name's Leanne Belton. Good afternoon, everybody, and thank you very much for having me. I am the clinical lead for the vaccination rollout programme at Pilgrim Hospital, and I was very fortunate to oversee the Lincoln programme initiated. And as Martin said, I was the nurse who gave the first vaccine in Lincolnshire to a lovely lady called Janet. So a tremendous honour. I feel very privileged to be part of this vaccine programme, and as my colleagues on the panel have all said, it really is quite humbling to be part of this. And yes, there are long hours and weekend work and evening work, but we're all very pleased to do it, and we have lots of staff who are willing to go that extra mile because it means so much to them. As I'm sure you can imagine, in the NHS, for everybody, it's been a very difficult time. The level of work has been unprecedented, and the things that we have seen and the lives that have been lost have been very difficult indeed. When the vaccine programme came to light here at ULHT, it was a light at the end of the tunnel. The buzz around the programme has been nothing short of phenomenal, and it again it's lovely to be a part of that. It's a huge collaboration of lots of staff that have come together and working really well together. So we have lots of data teams, we have volunteers that are helping in our trust, and we have lots of nurses, lots of healthcares who have come from all wakes of life and all specialities within the hospital that want to be part of this. So yeah, for me, it's the highlight of my career, and I'm very much enjoying it. So thank you for having me. I will hand you back to Maria now, and I'm here for any questions. Thank you.
Thank you, panel. Right, we're going to get on with the questions now, and I just want to reassure you, I see even a lot coming in through the question and answer function. if we don't get to those today, we will be getting responses to all of those from the panel and get those out to all attendees as soon as we can. So first question, we hear nationally that teachers, police, pharmacists, shop workers, to name but a few, will be offered the vaccine next. When will that be rolled out in Lincolnshire?
Thanks, Maria. Shall I open up with that question, and then
yes,
we'll
please.
kind of move along through colleagues? Yeah. So, really great question. Thank you to whoever asked that question. It's Martin here, the Director of Nursing. To some extent, I have to say this is nationally controlled. We've got very clear guidance that are issued by, there's a committee basically, which is the Joint Vaccination and Immunisation Committee, the JVCI as we say for short, and that sets the criteria as to who's going to get the vaccine and when. So when I mentioned right at the start the first 4 cohorts, there is actually 10, and beyond the first 4, which I won't go through them again because I've already said, but effectively it then drops in ages. So when we get to the 75s, the 70s, 65s, right down to the 50s, and we don't have a lot of wiggle room with that locally. They're nationally set, that criteria. So we will get to those other cohorts that are being described that don't fit within those initial high priority groups as we get through the age bands. Apologies there, my phone's ringing. So that's the clear answer with that. So
okay,
I'll move on to the next question.
Thank you. Next question, student nurses are asking why they've not been called up to give help and support with the vaccine programme when others are being employed to assist instead. Where's the rationale for that?
If I may, I just want to reassure our viewers that we do actually have student nurses here with us in the PRSA. They're an essential part of the team. They're really mucking in and helping, and yeah, they've been a huge success, and I'm very grateful for their support. So yeah, student nurses are here and they're fabulous.
Thank you.
And I would also say that student nurses are also helping in terms of the COVID response in the hospitals as well. So our use of them there perhaps means they can't go on and support in the vaccine hubs, but their support across the healthcare system is tremendous.
Okay, thank you. Next question, we have a number of related questions here about unpaid carers and privately employed carers and personal assistants, and that they are key workers, and why are they not being considered for early vaccinations, as they're a huge support to the health and care system?
Thank you. If I may, I'll pick that question up. They are absolutely seen as a vital role in the health and social care system, and as Martin touched on earlier, the Joint Committee for Vaccinations and Immunisations has recognised them as such. They aren't in the first 4 cohorts, but they are in priority group 6. So in terms of the sort of sequencing of this, they will come online very soon after the cohorts that we are currently vaccinating. They are a key part, like I say. They provide support to huge amounts of vulnerable people who will also be part of that 6th priority cohort as well. So those people will also be getting vaccinated at that point. In terms of, I think I've seen something in the chat about a question about how will those people be identified. In the local authority, we work with Carers First, who provide support to carers, and we do know about thousands of carers in the county who we work with on a daily basis and who are providers support on a daily basis. But clearly there will be a risk that won't catch everyone, and that's the same for a number of groups in reality. So we are working as a collective group of organisations to try and put the message out to the public where they think they are providing support to people. At the moment, we're looking obviously at health and social care workers particularly to try and ensure they self-identify themselves to us. So if they think that we won't pick them up because they may be privately employed, self-employed, then they can let us know that, and we can make sure we do pick those people up. Some of the linked questions to this, Maria, one of them does talk about privately employed carers, which I've just touched on. It also asks about when will personal assistants be vaccinated and how will they here. So this is people who provide support to individuals who don't receive a package of care from the authority, but instead have opted to receive the money themselves, and they directly employ support workers themselves. So again, as an authority, we know of about 3,000 of those personal assistants working in Lincolnshire already, and we're in the process of drafting the notification to them in the next week to start to describe to them the process of how they can book themselves a vaccination. But again, if there are personal assistants that aren't known to us as the authority, then we will try and make sure that we give those people the opportunity to let us know that they're there, so we can get them vaccinated as well.
Okay. Thank you.
Okay.
And a slightly linked one, it was around why those caring and supporting people can't be vaccinated at the same time as those that they're caring for. You're on mute, David. You're on mute, David.
Sorry, I didn't mute myself then. Yeah, so some of this is because we're being guided by the expert advice in terms of who we vaccinate and in what order. So for an awful lot of carers of vulnerable and older people, the person they care for will be naturally being invited in advance of them, just because of the kind of sequencing of how we're working through the priority groups. As we move down that list, when we get to the cohort of individuals who are unpaid carers, family carers, for example, if at that point they were likely to be getting invited at the same time as the person they care for in that same household, then that would probably be something that we'll be able to look at the time on a case-by-case basis. But at the minute, I think that there will just be a little bit of a gap before we start to get down to the unpaid carers and start inviting them. I think, Maria, this question also touched on young carers. So if I could just make the point that through the vaccine trials, the trials of these vaccines have been on adults, and they haven't been given to children as part of the clinical trials. And so at this stage, it's primarily an adult vaccination program and doesn't vaccinate younger people and children.
Okay, thank you for that.
Okay.
There's a question which I think has been touched on in the introduction, care homes asking when staff and residents will be vaccinated. But I notice a question that's come in through the question and answer, which says, how will new residents to care homes get vaccinated if that care home has already been done? And who is responsible for getting that new resident on the list?
Yeah, I can quickly answer that, Maria. We work really closely with the care homes across Lincolnshire. So I suppose the first bit of the question was, how soon will they be done? So we're working to a deadline to get them done before the end of this month, all of our care homes, and we're on target to do that. As of today, we've done about 75%, and we've got clear plans in place as to how we're going to do the rest of our care homes. And that's been done by what we call a roving model. So a lot of the, the colleagues of Dave Baker, for example, and his team will be going out physically to actually do those care homes. And then what we do is we work with the care home. So if there's other people who come into the care home a bit later on, if that makes sense, we'll make sure that they're mocked up. So we've got a very clear system of call and recall. And that's why it's so important in many ways that we're rolling a lot of this program out via our GPs, because they've got that information within the surgeries. They know the people who are on their registers, and they've got those smart live call and recall systems where they can find out who they need to do and make sure they get vaccinated.
Thank you.
Maria, if I could just add to that, every PCN has responsibility for a set of care homes. So David has some, I have some. So we've already been in touch with them, having done all of ours already. We're now going back tomorrow to get the new residents, and that will be ongoing. So we are in very close contact with the care home managers of the care homes that we are responsible for. So ultimately, that responsibility, David, I'm sure you'll agree, is ours, and that we'll make sure they're covered.
Thank you.
If I can just come in on that, yeah, we've got our care homes in our areas, and we are now moving to the housebound. So as of Monday next week, we will be rolling out vaccination to all of our housebound patients. So it's all in hand.
Thank you for that. Next question. For people without capacity, where a best interest clinical decision needs to be taken, how will this be carried out to ensure there are not delays or barriers to people getting the vaccine?
So, Marie, I think that David and I, this is a clinical question. So, from our perspective, our job is to make sure we get the right circumstances so the patient can make an informed choice. So, just because they have a diagnosis, that does not preclude them making an informed choice. So, it's our job to make them as best as we can appreciate and understand. And if they consent, all well and good. But ultimately, as I said right at the beginning, it's about patients, it's about safety, and it's about clinical risk. And on that basis, we will make the judgment of, with care home managers, with carers, with families, what's in the best interest of the patient in front of me. And we will just do that. Very clear guidance in our from the national team about this. Very clear assessments from the Mental Capacity Act of how and what we should be doing. That's what we will be using. I'm not sure, David, is there anything else you want to add to that?
Thank you.
I think it's all covered. Thanks.
Thank you. Next question. There appears to be logistical issues with vaccinating key workers, with them being asked to travel distances when they work in a vaccination hub. What's the rationale to make them travel further afield? Anybody?
Yes, sorry, that's I'm happy to take that one, Maria. What I can say is for the workers, for the staff that are employed in the vaccination hub here at the PRSA, we are offering them a vaccine because they're part of our health and social care workforce. So yes, vaccinating our staff here at the PRSA.
Yeah, and sorry, and just to follow on from Linda, absolutely, at the hospital hubs, our staff have been offered that vaccine in the hub that they are working in.
Yeah. Okay, and the final question in this particular section, I think David has touched on this. When will roving vaccinations be available to the housebound, and how will they be identified and contacted?
Thank you, Maria. I'll take that question. So I think you're quite right. It has been partially answered. We are in the process of moving the capacity from care homes, once they're completed, into housebound for the roving model. And our GP practices will be contacting all of those within those groups to receive that vaccination over the coming weeks.
Thank you, Rebecca. So we're now moving on to questions from the submitted general queries by the public. I've slightly changed the order of these to the one that was sent out via email. So I'd like to start by asking the panel question 7 on the list. And that is, can you explain how people book in for the primary care network and NHS England vaccination appointments? What information is received and from where? Who will contact patients, and how will you be able to pick your site?
Thanks. Rebecca, do you want to start with the
Absolutely. Thanks, Sunil, I will do. So absolutely, this has caused some confusion, I think it's fair to say, over the past week. So eligible patients will receive directly from the Department of Health and Social Care a letter inviting them to book an appointment through either dialing 119 or by going online. That letter allows an appointment to be made at our large-scale site, so currently the site in Boston. If there is no capacity at that site, and we are releasing the capacity days at a time in line with how we expand the capacity, so there may be points in time where the site availability coming up is either Norwich or Bedford. We are adding additional capacity daily to that to allow our residents access to the Boston site. So if you can't get access immediately at Boston, please do try again later in the day. The access into the local vaccination sites, I'm going to hand over to Sunil, who can explain that. They are different processes, and if you do not want to attend the Boston site or the future local vaccination site, our message is please do wait to be called by your local vaccination site, because you will be called. Sunil?
And that's exactly the point. So as GPs, we have lists of patients that we want to call, and our teams are working through the hours to call you. So we will call you, and it is our responsibility. As I said right at the beginning, we take this responsibility very seriously. David's already given you a scale of what he's doing. And multiply that about 10, 12 times across the county, you can see how many people are coming through on a weekly basis now. And we're getting supplies, thankfully, every week, and we will just keep going. So from a local vaccination site, your GP or a member of practice in your area will call you. May not be your exact GP, but your team of practices will call you and book you in. You'll have a time, and when you come to the site, you'll get vaccinated. So the responsibility is with us. I'm sure Dave will echo that. If you want to go to a mass site, that's fine. Between us as primary care network, we are very clear. We will try and cover as much of the geography as we possibly can between us. Even if you're closer to one PCN site than another, we will try and facilitate that as much as we can. Dave, that?
Yeah.
What you're doing?
Yeah, if I can just come in, just to give you an idea of the scale of this. I believe we've invited something like 14,000 out of our population of 130,000 already. So it is a little bit confusing for the public. You may get invited by your PCN site first. You may get your letter from NHS England first. But I think the message is you have a choice. And it may be the mass site gets to you first. It may be the PCN gets to you first, but you have a choice as to where you go. So it's fine.
Thank you. Next question I'm going to ask is actually number 25 on the list, and it's around transport. People may own their own vehicle but are not able to drive long distances, or they may not have transport. How will they be supported to get transport or access to vaccination centres or to register for the roving service?
Thanks, Maria. So if I start with that, and I'm going to then ask Dave to come in. For the roving service, GPs already hold those lists of individuals that are housebound. So this is no different than us taking a flu vaccination, for example, to those individuals that are housebound. So those lists absolutely exist. We've then got another group of the population who are not necessarily housebound in its truest sense, but may have some difficulty accessing our sites that have been stood up at scale, because it's slightly further than their GP practice may be. And in that case, we are currently working with our practices and our PCNs around a potential pop-up model within some areas, not all, because not all is required, but where the distance is great and we understand this difficulty of access. So that will be something that you may see popping up in areas over the coming weeks. Dave, I don't know if you want to say something about the transport helpline.
Hi, thanks, Rebecca. Yeah, so within the local authority, our transport services team run a transport customer support line. And so we've agreed with them that service can be offered to people as part of the vaccination process. So if people are really struggling to get to their appointment, they are able to call the customer transport helpline, and they will explore with them the sort of most appropriate option for them. So that may be public transport, although we know public transport is an issue in Lincolnshire, and it's been pared back because of the current lockdown as well. But they also have call connect services which can take people door to door, and that can support people with vaccination appointments. And equally, they work with the voluntary car schemes around the county. So if it's appropriate for someone to be directed to get some support to get to a vaccination appointment through that route, they can support them to do that as well. So that customer transport helpline, I can put it in the chat if you like what the number is for it, so that people can see that. Yeah, people are able to ring that to arrange some support or get some advice.
That would be very helpful, David. Thank you. So the next question, moving on, is when will the Lincoln mass vaccination site be open and operational?
Okay, thank you. Shall I pick that one up? So we are working really hard to get the Lincoln mass large vaccination centre up and running. There's a lot of work going on in the background at the moment, making sure that the site itself has the right equipment. There is what we could describe as a checklist of different things that we need to have in place to make sure it's safe and appropriate to care for and provide vaccinations on site. So we're working really hard to ensure that that will be up and running in the next 2 weeks, but obviously we'll confirm that when we've got that final go live date.
Thank you, Tracy. Next, should patients be asked to give signed consent to have the vaccine? And if so, why is that necessary?
Yeah, I'm happy to pick up that question as well. So it's really important when you're given the vaccination that you've gone through the vaccination process with a patient and you've been able to describe any of the potential complications. We do want people to have what we describe as informed consent, and that means that we've given the right level of information and detail for individuals. Some people come for their vaccination and they're very happy to proceed. Other people have questions that they might have about the vaccination or some of the side effects that they might experience. So we need to spend some time with individuals going through both what's the options, what does the vaccination provide for them, but also making sure that they are fully informed when they move forward and receive that vaccination. So we see it as an essential and important part of the vaccination process.
Thank you for that, Tracy. I've just realised I've missed out a question in my order. So I was going to ask question 26 actually up at the top of these, which is why is when people receive their letter and they phone and book via 119, why are they booking their second appointment at this point of their first vaccination booking? But if you go to your primary care network site, you aren't booking your second vaccination.
Maria, I'll answer that because it's a really quick one. So that issue's been resolved. So the answer is yes, they will book your second appointment. It's a really simple one. I won't overcomplicate the answer. Okay. But that issue is not an issue anymore. So your first and second appointment will be booked.
Okay, so to those who've already been to a primary care network and had their site and had their first vaccination, how will they receive their second appointment?
Yeah, the primary care network will book you when you have your vaccine. They will book you for your second vaccine. If there's people who didn't get that appointment, they will ring you and give you that appointment. Does that make sense?
Yeah.
A really clear message is, please don't call into the GP practices. The team will call you. They will tell you when you're due for your next vaccine and they will book that appointment. Okay. As we've kind of gone forward with rollout now, the system at the moment going forward is when you get your appointment for your first one, you'll also know when your appointment is for your second one. Does that make sense?
Yeah, and those who have already had their first but not got their second will be contacted and don't need to worry.
Absolutely.
Perfect, thank you. Next, this was a very, very common question, and it's around what constitutes vulnerability, because we talk about these groups that people are in and the order in which they'll get vaccinated. And so where people sit in the pecking order, really, with things such as cancer, asthma, heart failure, and encephalitis. What are the criteria for determining vulnerability?
So if I start, I'm sure colleagues will join. This is the category is clinically vulnerable.
Yeah.
So we have to make a clinical decision what vulnerability is. So, for example, we've had patients who've had asthma in childhood and never had anything since, and not on any inhalers and not taking anything of the sort, versus somebody who's needing oxygen just to carry on. You can see the scale of difference. They may both have a diagnosis of asthma, but the clinically vulnerable are the ones we're looking at. So, broad brushes are ones that are on shielded list. which we've been through time and time again, and we find as we've gone along, is just one category. So we're making a clinical choice, and that clinical decision comes on who will be most at risk if they were unfortunate to have this disease. So it's a clinically extremely vulnerable list that we're working our way through. But rest assured, we will try and get to everyone as soon as we can, but we will keep looking at that list. So back in March, we all had to go to the list, produced nationally but refined locally, and that process has gone on all the way through right up until now, and it's still ongoing. So that's how we decide.
Thank you. So so the GPs are working on it, and it's around clinical vulnerability. Thank you. Next question: if you have had COVID, do you still need a vaccine?
Yeah, I can answer that to keep it flowing, Maria. The answer is yes, because we know now that even though people who have had COVID, it doesn't guarantee they've necessarily built up immunity from COVID. So clear message there is, if you've had COVID, you still need to have the COVID vaccination. I'll keep it brief because I think it's important we get through the questions.
It is, yes. So next, how is support being offered to people with sensory impairments, both in booking the appointment, receiving the vaccine and aftercare?
Thank you, Maria. I'll take that question. It's Rebecca. So there are a range of options available to help individuals book an appointment either through their PCN or through the national booking system by phone or online. We have a range of materials available at our sites, and we also have the Connect to Support service for Lincolnshire, which again is a facility that will pop the details in the chat for everybody to see. And that's a service that's supported by live chat and by telephone as well. We'll pop the details in the chat for everybody to see.
Thank you, Rebecca. Next, can patients choose which vaccine they have? And I noticed that in the questions there had also been a number coming in saying, do you have to have the same one as first dose, second dose, or, you know, with the Pfizer and the Oxford? So
if I may, Maria. Yeah, absolutely. Not all vaccination centres are offering both vaccines. The majority of the mass vaccination centres are offering the Oxford vaccine, which is the AstraZeneca vaccine. And also to the second part of your question about whether you can mix vaccines. Obviously, we're following the national protocols, and we're sticking with both of your doses of vaccine should be the same. So if you had Oxford, the AstraZeneca for your first dose, you should have Oxford AstraZeneca for your second dose.
Okay, thank you,
Really clear on that, Maria. I think it's important we're really clear to the public out there. There isn't a choice of vaccine. So when you're called up for a vaccine, that's the vaccine that's available in that vaccinating centre, because I really want to be really clear with people that our underlying mission here is to roll out this vaccine as fast as possible to get through the population in Lincolnshire. And with that, depending on which site we're at, particularly with the Pfizer vaccine, and we have said this a few times before, but it is worth reminding people that there's a very strict requirements around how you can move the Pfizer vaccine. It's got very strict storage requirements, particularly about -70 storage requirements. So it's not as nimble in a sense of now that we've got the Zeneca vaccine. So, and that's the vaccine we do have in much, much larger quantities. So I would just want to be clear on messages there. Unfortunately, we won't be in a position to offer people a choice. The vaccine is the vaccine that will be available in your vaccination centre, whether you're going to a local one or a large one. And hopefully that helps.
Thank you, Martin.
Can I just add briefly though, Maria, that whilst there won't be a choice, if people do have allergies that mean they can't have the Pfizer vaccine, we will of course facilitate them having the alternative.
Thank you. So the next question, when listening to national news, we hear other parts of the country are starting to offer people in their 70s the vaccine. We understand that Lincolnshire has a high number of over 80s, but at what point will we start the over 70s?
So Maria, if I can just give you an example. So David and I, you both heard us speak today. I have 60 housebound patients in the entirety of my patch. David has probably a few hundred. So we are going to start the 70s very soon. David will sure do his best to do that again as soon as the over 80s are done and the house management carers done. So that's why you see this slight change in pace. That's only because we're keeping pace with the demographics that we're serving. But we are in Lincolnshire starting with 70-year-olds now. So it's beginning to happen. And I can see that accelerating very quickly now that we've got the mass vaccination site in Boston up and running, and David's already given you the scale that he's running to.
Yeah, if I can just come in as well. Just to assure you, we've already started inviting the over 75s, so quite a lot of our over 75s have been vaccinated, but we've been absolutely prioritising the over 80s.
Thank you. And then moving on, specific feedback is telling us that the over 80s are still waiting to hear about the vaccination programme. What date will the over 80s first vaccination be completed? I think we've touched on this in the introduction, so it'll probably be quite quick.
Yeah, I think that's me. And I can probably, there's a couple of questions there, Maria, that are about over 80s and why have we got those categories in the sense of the over 80s or the group of patients who are living in care homes who are over the age of 80s. The first one I'll pick off. So there's a very clear national ambition to have that cohort done by mid-February. So that's where we are in Lincolnshire, and we're on track to deliver that. We've tried to, if anything, we're confident and hopeful that we will deliver the over 80s cohort sooner. What I do want to maybe put into the conversation today, because I think it's a really helpful way of looking at it. We've had some national demographic figure quite recently that gave us a sense of how many people we need to vaccinate to save one life. So of that cohort of over 80, particularly the cohort who are in care homes, you only have to vaccinate 20 people to save one life. For over 80s who don't live in a care home, you have to vaccinate 160 to save one life. If you go right down the categories, for example, the over 50s, you have to vaccinate 8,000 people to save one life. So it just puts it in perspective as to why those categories were set the way they were. So it's absolutely over the last nearly a year, but definitely since last March when we hit the first wave pandemic, the greatest number of people in the UK that have passed because of COVID have been in that older age range. And that's why we're very clear that's the group we're targeting at the moment. And that's the group we're putting all our energies to make sure we do them as quick as possible. So I'm hoping that answers a group of questions there and one for you, Maria.
Thank you. That's very interesting information actually about the number that are needed to protect people within that area. So clinically, is the system delaying any treatment and care plans for patients and requesting they have both vaccines before treatment commences?
I can pick that one up, and essentially no, we're not. I mean, patients do have to give informed consent, so patients may choose to delay treatment whilst they have until they have a vaccination, but no, we're not doing that in most cases. I gather from my medical director that following national guidance, there are one or two exceptions to that for particular surgical specialties such as vascular surgery, where if someone caught COVID post-operate having the operation, then that will put them at significant risk. But those are small numbers, and obviously those are those patients in that category. The issue is discussed with them in advance, but generally no.
Thank you. Next, what should people do if they have a specific underlying medical condition and are concerned about getting the vaccine? How do they get advice to understand if there are any risks?
So, Maria, as Tracy has already said, when we consent people, we will go through the risks and benefits of the vaccination with them. And Rebecca's already alluded to the Pfizer vaccine and the contraindications. You can't have it if you have a severe anaphylactic reaction or you carry an EpiPen to that particular vaccine, but your vaccinator will go through that with you at the point of vaccination. And as always, you know, our patients can rely on your GP just to give them information if that is what's required. But there is an awful lot of information out there, so I'm sure Rebecca and others can point you in the right direction if that's what people want.
Thank you. Next, we can move slightly different subject. What are the side effects of the vaccine, especially of concern for those with other underlying conditions, and is the vaccine safe?
So, Dave, so we've all had the vaccine. You get a sore arm sometimes, a bit of a headache, fever. Generally, in 24 hours, it's gone. You may get a bit of a local reaction to your arm. And generally our experience has been very safe. We've had very few, thankfully, reactions. I can't recall anyone with a severe reaction so far that we've done, and obviously we've done thousands. So Dave, have you come across any?
If I may just interject there, from the hubs that we're running and in the hospitals, we've had very few reactions as well, and the vaccine is very safe.
Yeah, if I can come in as well, we've done literally thousands of vaccines. I had one lady who said she was developing a migraine, but she was a frequent migraine sufferer. But generally, you can get a low grade fever. You can feel slightly under the weather. The most obvious side effect that people get is their arm hurts a little bit, which is exactly what you get with the flu vaccine. But other than that, we've seen nothing really.
And same here from the PRSA side, nothing to report, no reactions to the vaccine. It's really safe.
Thank you. Next question, if there are supply issues with the vaccine, is Lincolnshire, this is a very hypothetical one, is Lincolnshire going to prioritise those that need a second vaccine or give it to people needing their first?
I can take that to keep us going, Maria, because I get posted on those figures on a very regular basis. We don't currently have supply issues in Lincolnshire, so I think that's got to be the straight answer. So based on our modelling of who we need to do within the cohorts, and I won't keep repeating in that sense, but we know who those top priority groups are. We've worked through that we have got sufficient vaccine. I do need to kind of manage that message, because I'm sure a lot of people, not just necessarily listening to particularly national media, I think there's been a lot of clear notices there to some extent that there might be anticipated problems with vaccine supply as we go forward. The government describes it as it might be a bit lumpy as we go forward. It might just be a term I would have used, but a good example with that is BioNTech, who make Pfizer. So that vaccine, that factory, if you like, or that production unit in Belgium reset itself over the weekend because they were remodeling their manufacturing process to try and increase output. So we already were given a signal that that might have an impact on future line and delivery of supply of vaccine. What I would like to be really assuring about today is that the vast amount of vaccine that we will be delivering is the AZ, the AstraZeneca vaccine, and that's the one that's been manufactured here in the UK. So we don't expect necessarily to have problems, but I do think it's sensible to give a message that we've never done this before. Nationally, we've never delivered a vaccination program at this scale before. Nationally, the manufacturers producing the vaccine have never had to produce it at the scale we need them to. So I suppose there's a little bit of expect some delay, because I think that's quite possible. But the really assuring message has to be to do what we need to do in the coming days and weeks. We're assured that we've got the right supply, and instead it's up to the national team to keep on top of that and keep it flowing for us, because that's what we don't want. We've got the right capacity now. We've got the right number of vaccination centres. We've got 13 local hubs, 2 hospital hubs. We will have 2 large vaccination sites. So we will have sufficient vaccinators and sites to do the people of Lincolnshire. What we don't want is vaccine itself being a limiting indicator. Hopefully that answers that question.
Yeah, thank you. One quickly now about inpatients. For hospital inpatients, will they be vaccinated whilst they're in hospital, or will they wait until they come back to the community?
Generally, we won't be vaccinating inpatients. The reason for that is that it will be difficult to call them back for their second vaccine, and we don't want to bring people into our hospitals if we don't have to at the moment. We're not doing patient visiting because of the number of COVID patients we have. So generally, people will be called to community places to get their vaccine. There's a small number of exceptions to that for some of our long stay patients on places like stroke unit, but they will be small in number, but generally no, not vaccinating inpatients.
Thank you. I think my video's off now, but I shall carry on. You can hear me. When will people undergoing treatment like chemo, radiotherapy and dialysis being offered the vaccination? So again, it's back to those priority groups.
Yes, is the quick answer to that, Maria, just to keep it flowing as colleagues go in. But yes, and particularly people who will be undergoing that type of, I suppose, more complex treatment. They'll be under the care usually of an inpatient doctor or a consultant, and they'll advise you about when it's suitable, at what time it is for you to take and to have that vaccine. So clear message there. The vast majority of people will be able to have the vaccine, but it's difficult to give general advice in these type of sessions because people have got different type of health problems, haven't they? But I would say discuss that with the person who's overseeing that care, and they'll be able to advise you as to when you can have the vaccine.
Thank you. And now, for people not registered with a GP, how will they be able to access the vaccination?
So hopefully we will allow them to have a mass vaccination site, which will be up and running. We, as I said, we're doing it in primary care groups. So we will vaccinate all of the people in our population rather than necessarily just those registered with a specific practice. And just as an example, it's on my radar in Lincoln to the homeless cohort when we can try and get to that cohort in a meaningful way. So that is on a list that we will get around to. So even people who don't generally register with them, we are trying to reach out to them. Maybe that's right.
If I can just come in as well, I mean, what's really important is that we try to get people registered with GPs, because it's not just about giving a COVID vaccine, it's about access to the whole of primary care. So I think this is an opportunity for us to actually target the homeless and the people who are not registered and get them registered so that they can get the support they need. But we will absolutely be searching out these people.
I just want to add to that, because I think that's a really timely reminder, David, and thanks for giving us the prompt there. So, because I think there's another issue here, isn't it? And that's about people on the call today, how you can help us. Because I think if you know somebody who's not registered with a GP for whatever reason, they might have moved into the area quite recently, they might not have re-registered, there can be a whole host of reasons. Please advise them. They need to get themselves registered with their local GP. That will make the rollout of this vaccine a whole lot easier. And it's about pushing a bit of the responsibility both ways, because it's got, you know, we can do so much, but we do need the general public to help us a little bit as well. And maybe just that last thing, because we have had specific efforts, particularly with the homeless population and some of our travelling communities. So I do want to assure people that we've got clear plans in place to what we describe as that cohort, which is that group of people, whether it's the travelling community or specifically people who are homeless. So we've got good plans there as to how we're going to vaccinate them. But really clear message, if people can help us push that out. If you're not registered with a GP, you really need to, even if it's a temporary registration, please get yourself registered. That will put you on our records quite literally, and then you'll be part of that call-up system, and we'll guarantee you'll be able to get your vaccination and get booked into a centre near you.
Thank you. I'm just going to come back to a question, the one about health conditions. And I think Tracy is going to add something about people with specific health conditions and who they should speak to. So Tracy, I'll come to you.
Yeah, thank you for that. So, yeah, I think because of the nature of different health conditions and the impact they have on people accessing the different vaccines, it's always best to have that conversation with your GP and also just to get that advice, or if you're under specialist care, often consultants that are dealing with that care are very happy to respond to questions about your own individual health conditions. So I think it's always advisable, if you're concerned at all, to contact the person that knows you best, can see your clinical record and can have that conversation with you and give you that health advice. Thank you.
Thank you. There's a question here, and I think it's general rather than specific to Lincolnshire, I'd hope so. It's the feedback that people are jumping the queue for vaccinations just because a family member is an NHS employee. How true is that?
I can answer that. I can be really clear. Perhaps if people want to separately give me some evidence about that, I can look into it. But that certainly has not been happening in our system. We've been really, really clear with that. Really clear about what our priority groups are, and really clear about our frontline, front-facing staff, both that be that NHS staff, local authority, and the other care and support groups of staff who go out and offer care in people's homes or through our nursing and care homes. We really have stuck quite tightly to that guidance, so there won't be any exceptions in that respect. I think sometimes, and this happens nationally, and I'm sure it happens to some extent locally, there will be occasions right at the very end of the day where there might be 1 or 2 vaccines, and certainly with some of, particularly the Pfizer vaccine, if it's not used within the required time window, it has to be discarded. So I think, Maria, that's where some of that's coming from. So rather than waste the vaccine, they then try and have what we call reserve groups, which is people on standby, so they will vaccinate. So I don't think that's happening in Lincolnshire, but certainly nationally, I think that's what's behind some of that rumour mill, why some people seem to perhaps have been vaccinated slightly ahead of other people. What I would say is please be tolerant in that way. This is about making sure we roll out vaccine, we don't waste vaccine. But I have to say, when we book our clinics, we book them on the number of vaccines we've got available. So we match it exactly. So the only reason we might have some left over is if somebody didn't turn up. And again, I'm really pleased to say that actually that's a fairly rare phenomenon in our system at the moment as well. So it's important we say thank you, because loads of people have responded really quickly. Plenty of examples where we've put a call out at really short notice and people have just mobilized and they've got there, they've got their relative there. The person themselves have just gone out of the way to try and get themselves along to the appointment, and they've done that in a really timely way. So we want to say a really big thank you that way and want it to be a really positive message there.
Thank you, Martin. And the last of the questions on this list is, how do the vaccines meet the needs of people with religious or ethical beliefs such as Jehovah's Witnesses or vegans?
Yeah, I can quickly answer that because I get asked it a lot on one of the kind of regular slot I do on the radio on a Friday. So we've been really clear about that in the messaging, and nationally it's really clear. There is no ingredients in those vaccines that should compromise people through their either faith beliefs or for cultural reasons. So there is no reason, and particularly if you go on to most of the national websites for the various different faith groups, because I've done it and checked, there's some really good advice there, you know. So what I would say to people within certain communities or cultural backgrounds, reach out to your religious or your spiritual leader. They will direct you to that advice. But the overarching message is, it's not a live vaccine in that respect. It's not got, you know, it is kosher, it is halal in that respect. So it's it should be okay for most people. So I can't see that being a problem.
Thank you. Now, it's been noted on the chat that we've had a lot of questions coming in about Sleaford, because we've all seen the maps where there's a small corridor with Sleaford in, where there isn't necessarily a very local vaccination centre. So I'd just like to go to Dr. David Baker, who's going to answer some questions on Sleaford.
Okay, first thing, what I would say is it is certainly far more efficient to have one large site. As I explained earlier, the site at Grantham, there's at least 25 members of staff on site at any one time. So certainly in terms of operationally providing such a big service, it is better not to split the resource ideally. Having said that, we do recognise that there are a number of patients from the Sleaford area that would find it difficult. Interestingly, the feedback from Sleaford patients has been really good, and given that we've been targeting the over 80s, the vast majority have been more than happy to travel to Grantham. Having said that, you know, we understand there are some people it's going to create difficulties for. So we're actually running a couple of trial sessions this weekend out at the Heckington practice and Ruskington as well. So we're just going to see how that goes this weekend. And I suspect what we'll be looking to then do is have a regular offer in Sleaford, probably out of one of our practices, you know, 1 or 2 days a week. So it is something that's definitely in our thoughts. we will almost certainly be having a regular offer at Sleaford. I would say that we would still ideally want people who are able to travel from Sleaford to Grantham to come to the Grantham site.
Thank you. Now, I am aware that we've had a lot of questions submitted via the question and answer, and as I said earlier, what we will do is that our panel have very kindly said that they will respond to questions, and HW Links will make sure that those responses get out to everybody so that all your questions will be answered. But I'd just like to finish with one that I found interesting, and that was for all attendees, and that was saying, how can we influence uptake? What can we do as the public to help this programme?
Yeah, I'll start with that, Maria, and maybe we could just quickly go around a couple of the panel. That'd be really helpful. So what I also wanted to say to people is that our communication teams and colleagues, they've worked really hard, and there's a very detailed FAQ, which we call frequently asked questions. And most of the questions that, or versions of, I would say, are already covered off in the FAQ. So Maria, we'll make sure we get out that script because it'll help give some of the detail. And I'm mindful there's a lot of questions there about the efficacy of the vaccines, and if you have it, how long will it last for? I just want people to know we've not ignored them because some of those questions are already answered. So in that written narrative in the FAQ, so we'll make sure we get that out. I think it'll help answer a lot of those questions.
Yes.
I think for me, what would be really helpful, there's a mix. There's something about being tolerant, isn't it? And please work with us, because when you're doing something for the first time, you don't quite anticipate all of the problems till they kind of run up behind you and grab you. So what I'm trying to say there is there will be some unexpected. Please don't start to think that that necessarily means we're not doing a good job. It's just the reality of where we are and the pace and speed of the rollout. So be tolerant to the program, I would say. The other thing I would say is there's a lot of negative media out there about the vaccine and how effective it is. You know, some of the faces of some of the people we've seen, and some of my colleagues on the call are much closer to this than me, but I was fortunate to spend a good bit of time in Boston on Monday, and I met quite a number of people who had not left their house since last March, elderly people who absolutely met the criteria, but they look at their face and the reality that after getting the vaccine, that meant their life would significantly change, and they could begin to think about how they can access their local community and no longer need to think about shielding and so on and so forth. So really, really positive thing. And it's a timely reminder as to why we're trying to do this. So what I would say, how can you help us? Please push out those positive messages. Really important you get your vaccine. Really important you hear that message. Please don't call the surgery. The local team will be in touch with you. When you do get that letter about the larger vaccination sites, if it's convenient for you to use it, that's okay. But if it's not, your local vaccination centre will pick you up. So it's important you hear that messaging. And equally, just to understand that messaging, if all the slots on the large site are fully booked for that day, it's an automatic system that will offer you vaccination in other neighbouring sites. And they can be quite a way away. But if you can ask them, please do. But don't be unduly worried about that, because the letter goes on to say you will be offered an appointment in your local vaccination centre. And that's a message I want to help you. Could you just help get that out for us? The vast majority of people in Lincolnshire will be done in their local GP-run vaccination centres, because that's how we planned it. That's where the volume is, and that's where the bulk of people normally go for flu. And we've got really good reputation of being able to deliver that year on year, and we want to continue to build on the back of that expertise. So they're my couple of key messages. I don't know, maybe David, not to put you on the spot, if you wanted to come in, and then we just open it up to the colleagues.
I think, yeah, we're running out of time, but if anybody's got any final wrap-up points.
Maria, could I just come in? I think my point would be that, you know, we're here this evening talking to residents of Lincolnshire. We are residents of Lincolnshire too, that are organising this programme for individuals within Lincolnshire, and we too want nothing more than our own family members having access to the vaccine as quickly as possible. So anything anyone can do to work with us, we will welcome that. We are committed to getting this out to our population as quickly as possible to make them as safe as they can be over the coming months.
Thank you. Anyone else before we finish?
If I can just come in as well, I just really want to try and reassure everybody we've got a really good firm plan. We will get out to everybody. No one's going to miss out on this vaccination programme, and we are going to get to you as fast as we possibly can.
Thank you. So to close this session, you did on your email, Martin alluded to some, spoke about some frequently asked questions document. Those, we did attach those to the email, but I think they're going to be added to now. And so we will make sure that more frequently asked questions go out to you. And I would urge you to read any of the information that we attached with that email, as it will provide additional information to that given by our panel today. So to close the session, I would like to thank our NHS and public health colleagues on the panel and those working behind the scenes. I'd also like to thank my colleagues at HW Links for organising this webinar, and to thank you for attending. I think it's been an extremely useful event and allowed us, the public, as Rebecca said, we are all residents of Lincolnshire, to hear directly from those who are planning and who are delivering the vaccination programme in our county. So once again, on behalf of everyone at HW Links, thank you for attending, and I hope you have a good rest of evening. Goodbye.
Thank you.